Perioperative nursing is the specialty that looks after our patients during surgery.
Patients are often asleep, so they can't advocate for themselves. So when they come through, we need to be their voices.
From the moment they come through the door to moving onto the table to moving back out to recovery, that we're with them on that journey.
They come into the operating theatre and when they see you scrubbed in that gear, they look at you and then we nod at them and like saying, hey, I'm here for you.
Most people have no idea how many people it takes to have one surgery starting.
Patients often come in here for just a few hours, but in the lead up to that we could know in advance, in months or weeks in advance. So there's so many components that need to come together.
Whether they have a 5-minute operation or a 5-hour operation, there's about 4 nurses that look after them through their journey.
Are you warming up? Yes, I am. Thank you.
You have your anaesthetic nurse, instrument circulating nurse, and then you've got the recovery nurse that looks after the patients post-op.
All right, just make you comfortable. Check things.
On the outskirts we've got managers, educators that are also nursing roles.
We have a lot of responsibilities to look after the patients and our staff. It's just very, very energetic job, enjoyable.
So I'm a new graduate nurse and we get to go through all of the different nursing roles. It's very rewarding.
So what makes a good perioperative nurse is knowing the operation, knowing the surgeons, having good communication.
If there's a patient deteriorating, they can step in.
You have to think everything. You are thinking a step ahead of the surgeon.
Knowing how to laugh and distress is one of the biggest things in theatres.
Have to be a strong person to be in the operating theatres.
You have to be able to show understanding and empathy.
Just hold their hand, create that little bond before they go into the theatre.
Even though they're under those drapes and you don't see their face, you know that there's a person underneath there and you want to care for them like you would care for yourself and for your family member.
We do try our best to provide the best quality of patient care. We keep up with our evidence-based practice.
Our professional association is called ACORN. They have standards that come out regularly and we use those standards to create our own policies and guidelines.
At the end of the day, it gives me 100% satisfaction in my job because I would give the same care to the patient as I would give to my family, and it makes me very happy.
It's what we do here. It's an important day for the patients, so being there for that, that's what I really enjoy about being a perioperative nurse.